stuff.
I gotta get this right here.
You are live.
We are live.
All right, we're live right now.
We're live.
Hey, welcome. Here we are. Chris is here
guys.
to answer all of your pharmaceutical questions, and it's not live with Chris.
No,
Live with Chris. Ask his wife what it's like to live with.
it's probably pretty scary. I don't know how positive she'd be about that one right now. So.
Yeah. All right. So, anyways, here we are, and Chris, do we have any questions so far?
Not yet. Looks like we got a couple of people. They're just popping in. So I think everybody's just getting on board here. So
yeah, I understand.
we got Brandon, we got Rob, we got Richard.
Yep.
So Roseanne, Doug, Susan.
So how are things going in the pharmaceutical world? Anything new and
Exciting?
Yeah.
Well, we're busy. So
Right.
Not a lot has changed for me with respect to what I do. So it's been probably pretty same old.
Sure,
So
sure.
The demands are the same, and we're helping people and doing what we can to keep everybody healthy.
absolutely.
Hopefully, coming out of this pandemic.
Exactly right. Yeah. So I suppose they're still doing some shots, some vaccines. That's all
testing.
part of the,
So we're doing
part of the work.
quite a few of that. So it looks like we're getting some.
Oh, are those all? They popped up.
Okay.
That many popped.
Okay.
We better get to work.
Confirm, deny. Oh yeah, there's actually from Miss Voodoo. Can you confirm whether or not birth control can make you gain weight? Yeah, it can. So it's just some of the hormonal changes that occur when we take an oral contraceptive or an implantable. And it kind of depends on the hormone that you take. The lower estrogen ones tend to have less weight gain. The ones that are more progestin based can cause more weight gain. So it just kind of depends. There's reasons for both, but so there is some issues. Definitely, there's about 40 plus choices out there with oral contraceptives alone. Plus, there's several other ways that, like IUDs and other things like that. That's obviously not oral, but, so there's other methods that you can choose to minimize weight gain if that's certainly a consideration. It doesn't affect everybody, but it certainly can happen from those hormonal changes. So hopefully that was helpful.
Do you want to remind them just to keep it about pharmaceutical stuff?
Yeah. So, and the one thing too, guys, I guess my expertise is all pharmaceutical. So, a lot of physical. We got Brad here to back me up if we get some trouble with physical therapy related questions. But we'll do our best to answer anything that you can. So let's see. Let's see here. Okay, there's a question actually for vaccine. Are COVID vaccines really safe, including J&J? Yes, the vaccines are safe. That's a pretty controversial topic. I mean, there's people that have distinct opinions one way or the other. I can tell you just from a pure scientific standpoint, the vaccines are very, very safe. The J&J is a unique vaccine because it's only a one-shot deal. So it certainly makes it a lot more convenient. So really within 14 days, you're well protected against coronavirus. And with the variants coming and actually becoming the predominant forms right now on the planet, especially specifically the Delta variant, I do think that it's certainly something that's going to be well worthwhile. I mean, getting the disease naturally versus having a vaccine and getting a couple of sore arm and maybe feeling a little under the weather for a day, it's a no-brainer. I mean, I think the vaccine is going to be a very safe, very effective choice to try and keep people from spreading the disease and staying well and staying healthy. So, excellent question. And I guess my point to that would be I don't support one or any one of the vaccines that are available. I would encourage you to get, because I think it goes a long, long way to helping you and getting more and more back to a sense of normalcy.
Yep.
Let's see here.
Someone wants to know how often you need to get a shingles shot.
Shingle shot. Well, that's basic. The old one that was out there was called Zostavax, which many, many people had, but now we have a newer one called Shingrix, and it's much more effective. And it's a two-shot series, and you're done. So you get your first shots day one, and then 60 days later, you complete the cycle with your second vaccine. So, and that's it right now. It's 95% effective. And over the age of 60, you got 1 in 3 people that can develop shingles. So it is well worth doing. It's shingles is no fun if anybody's ever had it. I mean, there's we have to put you on other medications to try and control those. And those can
Pretty
be
painful.
It's painful.
You get one shot and it's 2 months later.
Yep, 60 days later. So yeah, and it doesn't have to be exactly 60 days, but that's how it's designed. But I mean,
Sure.
it can be any time. Like some people we've had come in. Oh my gosh, I totally forgot to come in. Can I get my second shot? And by all
How
means,
many months later is there a window?
the manufacturer says up to 6 months,
I
but when the drug came out, and I think it was 2017, or the vaccine came out in 2017, they said 6 months was kind of a limit, but now they actually say a year plus.
Mm-hmm.
So as long as you get that second dose, it seems to bolster that immune effect. And,
Sure. Okay.
So, but I think if you get it within 60 days is best. 6 months to 60 days is probably the wheelhouse.
Ideal.
And beyond that, I mean. So instead of being 95% effective, maybe it's 89% effective. I don't have a real world number to compare that,
Okay.
but either way, you do want to complete the series if you can.
Yeah. Okay.
So Greg wants to know, can hormone blockers after breast cancer cause heart problems after taking the drug?
I think that's a good question, Greg.
We want to repeat it?
Yeah, well, hormone blockers create heart problems
After breast cancer.
after breast cancer. So a lot of times, if somebody would have, like a mastectomy or went through chemo, radiation, and then you get put on basically what they call anti-estrogens. So tamoxifen is probably the most widely used, although Arimidex, there's a few of them out there. They do have their series of side effects, but you don't see tons of cardiovascular effects, but it is possible. So I can't say it's not 100% no, but it's certainly for the most part pretty well tolerated. And generally, depending upon how, most of the studies suggest you take these things for 5 years after you've done chemo and radiation. So, and that's to help to protect you. We do have to watch out for other things like osteoporosis and things of that nature. So vitamin D supplement, calcium supplement, weight-bearing exercise, that kind of walks away from some of the cardiovascular aspects of it, but certainly something to be aware of when we're on those medications.
You just want to talk louder since there's no mics.
Oh, yeah. We'll talk louder. Sorry, guys. I guess we're too quiet, so I can definitely be louder. So hopefully this will come across a little bit more effectively.
I want to know how to get off gabapentin.
Gabapentin. All right. So I guess gabapentin you definitely have to taper off of. So that's certainly something that you probably want to work with your pharmacist and doctor because it kind of depends on where your dose is. Gabapentin can be dosed as high as 3,600 milligrams per day. That's maximum dosing. So that's like doing, so basically you would step down over time. So if you were at like max dose, it would probably take a good 6 months to taper off safely, at least in my opinion, just to be comfortable getting off of it. And usually you're just cutting down by a small increment and then just continuing going lower and lower and lower until you completely make a clean break from the medication. But you'd want to work closely with your physician because, and your pharmacist, because if you quit gabapentin cold turkey, you can go through withdrawal and that can be dangerous for your heart.
Yeah, I had a patient, she decided to go off it quickly and she was sorry she did. It was not fun.
No, it's really uncomfortable and you're rebounding with pain effects and it's something you want to do very judiciously and very carefully and very slowly. It's just like any drug, whether it's an antidepressant, whether it's gabapentin or an opioid, any type of, or a benzodiazepine for that matter. So anything that has a component that your body becomes very, very relied upon, you do want to taper off slowly. The key is slow. So Rome was not built in a day, nor were these effects with these medications. So your body needs a little time to adjust and get used to it.
Sure.
Here's one for Brad and Chris.
All right, from Ann. Hey, costochondritis.
Yes.
All right, better to keep taking ibuprofen to help healing or try it without?
If I'm referring to Steve August, who's a physical therapist in New Zealand. He's one of the experts in costochondritis. He had it for 7 years, figured out how to get rid of it through treatment with exercise. Actually, it's a mobilization, and you treat your backside, and that's what I do. I have costochondritis. Went to the emergency room 3 times with chest pain, make sure my heart was okay. Saw the cardiologist, and now I treat myself with it's called a back pod. You don't have to use it. You could use a tennis ball, and you mobilize your ribs where they connect to your spine, and you need to do it daily. I do mine 3 times a week now because I've got it under control. But once you learn how to do that, it's worked well for me. It's worked well for Steve. The ibuprofen is probably not going to give you relief. If it is working for you, fine, but you don't want to continue that. And Chris, you can talk about long-term use of ibuprofen.
So with ibuprofen, it's one of my favorite NSAIDs. I think it works really, really well, but we have to use that carefully. Long-term can have problems with your kidney and your heart. So it's just to be used judiciously. I think if you're having a bad day, and you're stiff, you're tight, you're painful, I think it'll give some reasonable analgesia or acetaminophen, paracetamol. I think that can certainly be used as well, or even in conjunction with it, just to give you some pain relief. But if ibuprofen is your drug of choice, make sure you're hydrating because it goes through your kidneys. So we want to be super careful with that. And it's also why it helps to protect your heart. But also not the ibuprofen, but the hydration. And then, that hopefully will help to at least control some of that for you. But I mean, it's like Brad said, I think that the physical exercises and stretching techniques, I think are going to be a far more lasting and sustainable way to treating that than using just medication alone.
Yeah. And you can Google or just search on YouTube, Bob and Brad costochondritis. The videos will come up showing specifically what to do, or just search Steve August and put costochondritis, and then you can listen to him talk. He does a better job of explaining the details. Actually, it's almost more to the professional level he talks about it, but also to the layperson. So I wish you well with it. There's definitely a way that you can manage it and really get feeling better with it without taking any pharmaceuticals. So good luck with it.
That was a great question.
So this is going to relate if this is going to be a good question for you, not. Do you deal with like supplements at all?
Yeah.
Yeah,
absolutely.
Okay. So someone wants to know if there are any supplements to help repair the adrenal glands. 15 years of 600 milligrams of caffeine, he's done 200 milligrams every day.
So, all right. So let's see. It's something to repair the adrenal glands.
Yes.
That, I have to say, it's an excellent question, and probably, frankly, you've got me pretty stumped. With the
Maybe we should repeat it in case they couldn't hear.
So I was wondering if there were supplements that could be taken to help stimulate the adrenal glands.
Yes, to help repair.
Yeah, and I mean, if you have adrenal insufficiency, a lot of times that's caused by long-term steroid use, but it can be other things as well, congenital things in that nature. Usually the treatments that they use are ironically can be steroids, but there's a lot of it's beyond my level of expertise. I know of no real vitamin supplements that are really going to stimulate your adrenal system. I mean, it's part of our fight. I mean, it's lower brain activity that helps to try and get those things kind of firing. But when it doesn't work properly, and invariably there's subsets of our population that aren't going to have great functioning. But I don't know if there's going to be a specific vitamin per se that's going to go out there and turn that around. I don't think copious amounts. And it sounded like they were using caffeine.
Lots of caffeine from 600 milligrams a day.
Then they're down to 200, so they've reduced their caffeine intake. I guess I'd be curious to see how they feel since they've reduced it. But I'd probably be working with an endocrinologist specifically, because I think that they're going to have far more insight into that condition than what I could probably provide.
Okay.
All right.
All right.
Jerry, let's see. All right. Talking about cannabis for many of my pain and inflammation issues. Still on the fence about it. Any thoughts? Hey, Jerry, that's actually a really good question. I do think that.
So what is cannabis? Is a question about
cannabis
pain?
would be, yeah. So he's talking about specifically cannabis itself. I'm probably more on the CBD train than I am cannabis, only because the psychoactive components of cannabis can lend itself to problems as well. But I mean, the reality of it is, I can say there's a wide burgeoning amount of evidence that's telling you that things that, whether it's cannabis driven or CBD driven, they do seem to have a positive effect as far as its anti-inflammatory characteristics and pain relieving characteristics. So there's definitely something there to the research. I think more research needs to be done. I think we're kind of tip of the iceberg right now. And I think when we we did a kind of a discussion about the endocannabinoid system in CBD not that long ago. I don't know if it released.
Yeah, I believe that is out. We've got a YouTube
couple
and a podcast on CBD oil.
But the reality of it is that the endocannabinoid system that our bodies all go through, we have natural versions of that too that do help with our pain relief. I do think that things like CBD will probably help out. Just to piggyback on that, Jill is asking, how does CBD interfere with blood clotting? And actually, Well, if you're on a specific blood thinner, it can inhibit how those drugs work effectively. So you do want to be mindful of that. CBD it's part of, I think that the reality of it is, I don't think you're going to have a direct clot or stroke, but if you have a tendency towards those things, or if you're on blood thinners, you have to be careful because it can actually make the blood even thinner. So it's something that you would want to talk to your doctor about exclusively, and making sure that they're testing for those types of things, and be honest and upfront with your doctor with what you're using.
So the big difference from the cannabis and the CBD is the THC.
THC content. That's the only difference. Is it might be a little bit more psychoactive.
Sure.
The reality of it is, whether it kind of depends on what you use. Whether if you smoke it, if you ingest it like with an edible, topicals. So there's different ways of achieving benefit. And I mean, I would say if you're going to use a cannabis derivative product, I'd probably say, if anything, I'd probably go more topical. I would say that'd be safer. It's going to be less psychoactive. Although you get to an appreciable level of THC in your blood system, you're going to have some of those variances, and certainly some of the sideways stuff that you can get experience from THC exclusively.
Oh, here we go. Joanna, I hope we got it.
You got shingles shortly after receiving your second dose of Moderna vaccine. Would antibiotics affect the effectiveness of the vaccine? Joanna, that's actually a really good question. The antibiotics should not affect the effectiveness of the vaccine, because that's for a bacterial type infection, whereas the vaccine is for a viral infection. The reason that you probably received shingles from getting your second dose of your shot, whether it's Moderna, whether it's Pfizer, whether it's J&J, or whatever, AstraZeneca, or whatever else is out there, could simply be that we stressed your immune system. Shingles is an opportunistic infection. So when our immune system's stressed, so meaning we've received a vaccine, or you've caught a cold, or you've gone through something stressful, or an accident, or an injury, shingles finds a way to make its way through. So it's just dormant chicken pox that kind of breaks through when you get that. So when you had the vaccine, it stimulated, your immune system was busy learning that second dose. And so as a result of that, it kind of took away from what was probably keeping your shingles at bay. And so they erupted, unfortunately.
All right. Good question.
Very good question.
Next one.
All right, for Glenda, let's see. Take pramipexole for a restless leg, and you started having problems with your posture, bending at the waist. Something other than changing yet to another med that you can do. Well, that's an interesting side effect, Glenda. I wish I could.
What's
Pramipexole?
Yeah,
it's used for Parkinsonism, and it can be used for restless leg. But with restless leg syndrome, it's when they try and sleep, their legs are all heebie-jeebie. You just can't get comfortable at night. And so drugs like pramipexole raise dopamine in our system, which is a neurotransmitter that helps those nerves kind of fire more efficiently, and takes away the need to feel bad. Having problems with posture and bending at the waist seems like an unusual set of side effects, but I will tell you that all medications can have unique side effects specific to people. They're called idiosyncratic side effects. I'm not aware of pramipexole creating that scenario directly, but I would say indirectly, anything can kind of be possible with medications. If you are noticing that there's something negative, you might even want to consider seeing if it's just something that happened to be a coincidence at the same time. And maybe seeing something like my man here on my right, Brad, might have an idea about how to try and correct posture and bending, but we need some specifics to answer it more effectively.
Yeah, there's a number of exercises or stretches that could be done to help correct that posture, but is that, how to correct it in relationship to as a result of the medication? What I haven't heard of that, but I don't doubt that this is, you're telling us what happened.
Yeah, and you observing it, Glenda, you observing it while you've started the drug, and if you've noticed that it's just right after you've taken it, I mean, if it looks like a duck, it walks like a duck, it's probably a duck. So, I mean, it very well could be from the drug. It's unusual. I would bring it up with your doctor. I would probably work with your doctor to consider physical therapy to see if it just happened to be a weird coincidence. The other thing you can do is go off the medication, but then, like you say, there's that frustration of changing to another med, and there's only a handful of medications that you can really take for restless legs. So, I mean, you can go to another leg drug like carbidopa, levodopa. Some people have had some success with gabapentin and pregabalin, which is Lyrica. So I think those are things that you could certainly consider if you haven't tried those. Pramipexole is certainly something that I think a lot of doctors like because it's pretty controllable and for the most part works effectively. But not every drug is for everyone, and it looks like you've tried a couple of things. So I'm sorry you're experiencing that side effect, Linda, but I would definitely bring it up to your doctor as soon as you can.
I have no idea how you can remember all these pharmaceutical drugs that have these words I can't pronounce, and they're 472 letters long. It's incredible. Oh, here we got one from
I'm a super nerd. I don't have a
is it Janet.
All right, Janet. Hi, Janet. All right. So, husband, 81 years old, fell off a 3 or 4 foot deck in December, fractured 5 ribs in the back. Nothing has helped him with his pain. He's had 2 different injections, a compound cream used 3 times a day, therapy, massage, and is now seeing a chiropractor. He's very careful about his medications. Is there anything that he can try for the pain? Well, gosh, Janet, that sounds awful. 3 or 4 foot fall, that's nothing to joke about. That's a big deal. A lot of times, the chiropractic care, physical therapy care, I think are going to be things that it sounds like you guys have been dealing with this for going on 2 years as we approach December here. So you're about 18 months now.
And rib fractures are
Awful.
Yeah, they're painful. Just to breathe, you can't laugh. All these things that make life really good is challenging because of pain associated with it.
There's a lot of nerves too that go into that section. So
Yeah.
I wish I could give a more direct result. I guess I would say just with an age like 81, I'd make sure you're getting plenty of vitamin D. I'd probably suggest doing about 800 to 1,000 IUs or about 25 micrograms, depending on how you buy it. That might help at least facilitate with calcium resorption and help maybe harden those bones a little bit. I don't know how much it's going to facilitate healing because it's an older injury now.
Yeah. The only thing, it sounds like it's been around long enough, and if you want to, if you haven't tried a TENS unit, capital TENS, it's one of those things that if you're not familiar with it, there's electrodes that you would put to the skin, and there's a little box that you. Here we go.
There we go.
Yeah. Here's a box that it comes in here. This happens to be I Relieve. We promote these. They're great units, but there's a lot of different ones. You don't pick whatever you want, but that might be an option. You're probably going to have to go see a professional, a therapist to make sure it's okay. Typically, there's no side effects unless you have a pacemaker or there's a few other things, but that's a big one. You cannot use it with a pacemaker for sure. But a TENS unit might be a good way to help manage the pain so you can get things moving and maybe break up some scar tissue and get this back under control. Yeah. So that may be something to look into. Talk to your doctor first about it.
Yeah, definitely. I'm sorry to hear that, but hopefully you can get some relief.
Can you get shingles more than once?
Yes. The question was, can you get shingles more than once? And the answer is absolutely yes. That's why we kind of started out, and one of the questions was getting the vaccine is probably about the best thing. So if you're over the age of 50, I would strongly urge you to get the vaccine. Shingles can be opportunistic, and I can tell you that I work with a guy who was a pharmacist with me that prior to becoming vaccinated, and he got the first one, the Zostavax, which is generally no longer used. And he was still, it cut down to shingles. He used to get shingles attacks about 4 or 5 times a year. And when he got the first vaccine, knocked it down. He didn't have any for almost 5 years, but then he started getting a little flare up here, a little flare up there. And then we got him on the newest one, the Shingrix, and he's been much, much better. But I do believe he's had 1 flare up since he's had that vaccine too. So shingles is tricky stuff in times of stress and immune system, like we said kind of earlier in the cast, is something that it can come out. The vaccine will certainly help to bolster your immune system to try and mitigate it. And if you do get an eruption, it typically is a lot less severe than what it would be otherwise. One of the biggest keys with treating shingles, just in general, if you guys ever get it, is to recognize it. Usually it's on one side of the body or the other. It can be anywhere. So it can be, a lot of times it's your upper torso. It's real dangerous if it gets near your eye. So we want to be real careful. I mean, it can cause blindness. So if you're not treated appropriately or quickly, it can be a very big deal. So usually what they'll do is place you on antiviral medications to try and slow down, because again, with all viral infections, they have to run their course. So when we use things like valacyclovir, acyclovir, or famciclovir, which are the 3 that are available in the United States, all of them are very effective choices to treat that. But the key is getting it in within 48 to 72 hours of getting those lesions. And a lot of times people are like, I got this little itchy spot, or I've got this little rash, I'm kind of itchy, or it sort of burns beneath the skin. It's not easy as a doctor to actually diagnose it. I always see it after the fact, so all the hard work's been done. I don't have to figure those things out. I just tell people how to use the medications. And if you do get to that point, just make sure that you hydrate really well. Those drugs like to go through your kidneys. So, and if you have renal impairment, make sure you're sharing that information with your doctors.
Sure. Oh, what do we have here?
All right.
Leote?
Leote?
Well, we hope we're pronouncing that right.
All right. Hi. Thanks for chiming in. So what are the best things to take during a cold? Well, actually eating well, hydrating, and resting are some of the best things that you can do. Vitamin C supplements, the studies are kind of mixed. We've seen some studies that suggest that if you're a pro athlete, it might help to mitigate the symptoms by about a day or two. Zinc supplements do seem to stimulate the immune system, and you might speed through a common cold 1 to 2 days faster. So those are probably, but people consider echinacea as a choice to help to bolster your immune system.
Echinacea, which
is
is
a plant.
Oh,
so yeah, so it's an herbal product. Some people use elderberry and bilberry. So there's a lot of different things that stimulate our immune system and also have antioxidant action that seem to work with our immune systems to try and help to stimulate that. When I knock on wood, I don't tend to get sick often, but when I do, there's a product that I like. The brand name is called Airborne, and it uses high dose vitamin C. It's got a little zinc, a couple other little copper, and a couple other things that seem to bolster the immune system a little bit. I think one of the keys of making that work effectively is hydration. They make a chewable tablet, they make an effervescent tablet. I like the effervescent tablet because it forces you to drink more water. And water uniquely works with our immune system to try and help our body to kind of flush out all the toxins, all the yucky stuff that our immune system is fighting. So hydration, rest are really some of the bigger things. And you might speed your way through a common cold by about a day or so using those types of supplements.
Sure.
All right, let's see. All right, what is the best natural treatment for anxiety? I hear ashwagandha is good. What is my view? Greetings from the UK. Hey, UK. I think ashwagandha, I don't have a ton of familiarity with it. It's a root. It seems to,
so you can buy that.
Yeah, you can get that from, I guess here, our food co-op has it in the Cross area. I think you can get it online.
Is it a pill form or what?
Yeah, I think what they do is they make it in capsule form.
Okay.
So it's a root, I believe, is ground up, but I'm not 100%. It could even be the bark. So again, it's a little bit out of my league. I can tell you that with over-the-counter products for anxiety, the two natural substances that I have the most, kava is certainly something that works pretty well, but you have to be careful with that because it does act like a natural benzodiazepine, like say a Valium or a Xanax. It does have an addictive component to it, though it's natural. So we do have to be.
What's it called?
Kava,
which is
just another
plant
herbal product used for anxiety. People use it for sleep. Chamomile seems to work pretty well. It's a tea.
Sure.
So, and people drink that to try and relax. So I think that has its place. I typically, for anxiety, unless you've lived through it, it's a miserable experience. But those of us that have not experienced it, you just kind of go, wow, I don't get it. It's an awful, awful feeling. It's an overwhelming sense of dread. And so there's a variety of things that people have tried. People have tried CBD oil, which does, ironically, and cannabis, believe it or not, tends to cause more anxiety. So we tend to avoid that recommendation. But CBD has had some places where for some people it's worked well, some people it doesn't work well. The studies are inconclusive and more evidence needs to be garnered from a natural standpoint. I tend to, if anxiety happens frequently, I would encourage that you see your doctor. I think there's cognitive behavioral therapy, which is non-drug stuff, that helps you to kind of understand anxiety and how to naturally treat it with, say, relaxation techniques, deep breathing, exercise, and those types of things. But when those things fail, the pharmaceuticals would be probably another way to consider. I'm not a big fan of the benzodiazepines, but there is appropriate choices at times when you use it, but we have to be very careful with the addiction rates. So then going to the the selective serotonin reuptake drugs, so like your sertralines, your fluoxetines, paroxetines, all have a place in managing anxiety, but those are prescriptions that you would want to discuss with your doctor. I wish I could answer a little bit more about the ashwagandha, but it's just unfortunately not something that I'm terribly familiar with. So my apologies to the UK.
All right. Is it Kaylee?
Kaylee or Kaylee?
Kellyanne.
All right, thanks for calling. Is there a difference between Gabapentin and tramadol? Absolutely, huge differences. They're two drugs that work both for trying to help treat pain, but tramadol is basically considered a narcotic. It's a congener. So if you think of morphine as the granddaddy of all opioids, tramadol, they kind of just did some funky chemistry to pare it down to bring it to its grassroots of just the meat and potatoes, meaning it works for, it's a modest or moderate analgesic, meaning it helps to minimize pain. I don't think it's really much better than, say, acetaminophen. So tramadol does have an addictive component, so I'm not a huge fan of it, but it has its place for certain people when other things simply don't work or they have allergies to other medications, so it might be a better than nothing choice. Gabapentin, on the other hand, is an old-fashioned seizure medication that's routinely used for pain relief. So whether it's neuropathy, whether it's migraine pain, it can be used for anxiety. It's kind of a jack-of-all-trades drug, but it works in the GABAergic pathway, and so it kind of slows down neurons from firing to allow, it kind of relaxes things. It kind of keeps things in a more relaxed state. So that's how they believe that some of the characteristics of pain, it helps to bridge nerve pain a little bit more effectively so that you're getting some relief. It's not widely understood, but that's what they think, at least right now. But they are different drugs, both, and gabapentin can be abused too, but not nearly to the extent that tramadol can be.
Okay.
All right.
Good question. I
Yeah.
was curious about that myself.
All right, Patrick. All right, recently had an MRI, confirmation of hip arthritis. So he's 52. Turmeric as a spray each day to reduce inflammation and pain. I guess, Patrick, I don't know if you're trying to do it topically or if you're taking it orally. Turmeric is actually a natural anti-inflammatory. It's an NSAID, just kind of like ibuprofen, aspirin, naproxen, sodium with the prescriptions, you have nabumetone. So I think turmeric definitely has a place. I'm not sure if you're spraying it in your mouth, if you're spraying it topically. Topically, I do know that things like diclofenac gel work, but not really well in the hip. If it's a topical application, the hip is such a deep joint that those types of topical medications, if that's what you're doing with your turmeric, don't necessarily penetrate. Orally, I think turmeric, especially if it's coupled with black pepper, work pretty effectively as an anti-inflammatory. So as long as you're not on blood thinners, as long as you're not experiencing any allergies to anything like NSAIDs, which you would have known by now at this point. But I do think it's got its place. I'm hoping that at 52, I'm in your wheelhouse, turn 52 in September. So I feel your pain. I'm hoping that with that hip, that, with therapy and exercise, maybe there'll be some avenues to it. It just depends on the damage in that hip, though.
Yeah, but one way or another, you want to keep that joint moving as long as it's hopefully it's an early onset part of the arthritic part of it, so that you want to keep that joint moving, pain-free. Typically non-weight-bearing exercises, bicycling, stationary bikes, swimming, things to get it moving, to keep the joint healthy. Joints like to move. If they stay sedentary, the arthritis just gets worse, unless it's way at the far end, but it doesn't sound like it is at this point.
Unless it's like surgical or not. So I guess we don't have full information,
Right.
but I think keeping that thing mobile is huge, and treating as needed with anti-inflammatory medication is appropriate, as long as it's not overworking your kidneys. So hydration is still very important there as well. Great question.
All right, nice one. Chris Perkins.
Hey, Chris. All right, what is the safety of long-term pantoprazole PPI, proton pump inhibitor, for the treatment of GERD? Chris, that's a great question.
We better say what GERD is so everyone knows.
Gastroesophageal reflux disease.
Heartburn?
Heartburn.
There you go.
So there we go. So yeah, it's a controversial topic there, Chris. So I'm glad you brought that up. Brad and I actually did a discussion about some of these a while back. But I think short-term, definitely the way to go. Long-term, the jury is still out. I've been dispensing these types of medications for over 26 years since I've been a pharmacist, and everything's kind of come full circle. When I came out in 1995, people were taking it forever, and I've got patients that I still see that still take the medication. So you're talking 26 plus years of using it on and off. What we've found in that subset of people that use it long term is that it can be problematic for the kidneys. It will be problematic for your bones, meaning it can increase your risk for osteoporosis, or make you osteopenic, because we don't absorb when we're suppressing stomach acid to control the reflux symptoms that you're getting from the heartburn. You don't absorb calcium as well. Stomach acid is the number one thing that breaks down our nutrients, and calcium is tricky to break down to begin with. So whether you take a supplement, it's better to get through natural sources. So it's going to be like, if you're vegan, it's going to be green leafy vegetables, certain nuts and seeds. If you're all right with dairy products are the way to go because you get calcium oxalate. It's a much more readily absorbable form of calcium. Otherwise, you can go to the supplements like calcium citrate, calcium carbonate. So going into this question as I'm talking about all these calcium supplements, when we have our acid reduced, we don't absorb calcium the way we need to. So you should be on a vitamin D supplement if you're using this long term, and probably consider calcium supplementation to protect your bones. Also, when we take PPIs or proton pump inhibitors, things that are acid suppressing medications long term, increased risk for your coughs, your colds, your pneumonia, your COVID infections, flu. Your stomach acid is actually one of your number one defenders against infection. So even if they're respiratory infections, when we inhale, some goes down another pipe. So your stomach acid is there to try and protect against that. So when we're suppressing stomach acid long term, I think there is the potential that we can become more sick. So what do you do? Well, some of us have these conditions where we're just naturally kicking out stomach acid for more than the average bear. Sometimes we just have to take these medications long term, but work with your doctor about an exit strategy. Sometimes they will slowly taper you off of these medications with the hope that you can hopefully just with diet, exercise, eating well, minimizing trigger foods that we can get you off of these proton pump inhibitors. Also, I didn't touch on a small chance that there are some conflicting studies that say they could cause some memory issues. The data seems to suggest that some of that may have been a little bit premature, but there's still enough out there that says long-term we should be careful with the use of these medications. So if you can get off them in, 6 weeks, 8 weeks, 6 months, that's ideal. But for some of us, and we've had people try to go off it, they end up having to go back on it because their acid secretion is just so strong that it creates those symptoms. And if we don't control that well, there's a variety of other things, even as serious as esophageal cancer, that can develop. So it's a tricky question. You want to work directly with your physician to make sure that the length of treatment is appropriate. And then, work with your pharmacist, work with your local doctor to find out what best strategies you can employ to try and minimize the problems that are associated with long-term use of PPI type therapy. So excellent question. Sandy, what is the best drug to take for IBS or Crohn's disease? Sandy, that is a excellent question. IBS and or Crohn's. Tough stuff.
IBS refers to
inflammatory bowel. So inflammatory bowel syndrome specifically. And it's a disease that's characterized by lots of diarrhea or constipation. So you have constipation dominant or you have diarrhea dominant IBS.
Okay.
So, and then Crohn's is a different disease state itself that's more in the GI tract, where actually what happens is that your immune system attacks. It's autoimmune, so it's related to, like, say, rheumatoid arthritis.
Sure.
So and it's treated with immune suppressing drugs. So with respect to IBS, eating well, avoiding trigger foods that can set you off, hydrating well, staying active are certainly some things that will work. If you're constipation dominant, there's certain medications that your doctor can prescribe to help to kind of mitigate that if your gut's not firing properly. So there's a variety of different medications that we use. And then with Crohn's, basically you'll probably start you on a steroid right away, like a prednisone, to try and calm down Crohn's, to get it to kind of remit. Because your immune system is attacking your GI system, and it looks like somebody just scraped off, looks like road rash, basically. So if you scraped your elbow because you fell on some concrete, that's what's happening in your gut. And your immune system, it's just raw, irritated, causes lots and lots of pain. It can be to the extent where you have to have parts of your gut removed to very, very extensive surgery. So they use immune suppressing drugs. There's a variety of those as well, like the biologics, which are typically injectables, although they do have oral ones. They do infusions. So you can take things like methotrexate or hydroxychloroquine. So there's a lot of different medications out there that can be utilized for Crohn's, but you definitely want to be with somebody that is very, very knowledgeable about Crohn's and IBS. So whether it's a gastroenterologist or even a rheumatologist or both, very important. It's something that we have to take care of, because if untreated, they can create new scenarios and new problems as well. So great question. It's a tough disease state to live with, but livable with the right medications and lifestyle changes.
Samantha.
Hey, Samantha, benefits on magnesium vitamins. Yeah, hey, Samantha, that's a good question. Magnesium is often hard for us to get in our daily diet. If you're in the United States, there's no way we eat properly enough to get enough magnesium, because nobody eats enough vegetables to probably do that. So taking a magnesium supplement is beneficial for a lot of different things. It comes from muscle action. It helps to prevent headaches. It can help with, it helps, actually milk of magnesium, if you think about that, it's used for constipation, which actually, if you ever go on a magnesium regimen, probably should make sure you're aware of that for the first few days, because your bowels will be a little bit more free when you start a magnesium supplement. So just be aware of that. Start at a lower dose and gradually build up to like twice a day, depending upon what dose level your doctor may recommend. It can also be used to help with sleep, migraines. So it helps with diabetes and blood sugar regulation.
What are some of the best foods that have the highest magnesium
Yeah,
content?
so food, it's going to be your green leafy vegetables. So we talk, spinach, kale, broccoli, certain nuts are certainly excellent with that.
Sure.
So things that come from the earth work really, really well with that to give natural magnesium. It has a lot of other things in it, calcium as well. And so magnesium also works for muscle functioning. So for people with, like fibromyalgia, magnesium seems to have a place with muscle functioning. People with have chronic fatigue syndrome, just muscle pain and weakness, it seems to help with action potential possibly. So it's not going to hurt you. It's certainly something to work with your doctor. Make sure your doctor's aware of it. Certain medications can interfere when we're taking magnesium supplements, certain antibiotics and things of that nature. So and certain stomach acid medications that we use. So separation and appropriate timing of the supplements are very important too. So work with your local pharmacist, work with your local doctor to make sure you're using it appropriately. But I do think magnesium has a place for a lot of people, and I think it's probably underutilized in a lot of cases. Okay.
Which side?
All right. So, sorry, Dan. All right. So, Pat. Hi, Pat. Thanks for chiming in. All right. You're allergic to aspirin, ibuprofen, and acetaminophen, and you get anaphylaxis. That is awful. What can you do for a toothache? Pat, a lot of the things that we like to use for you are off the board. So with those types of allergies, and you're going anaphylactic on all those, because acetaminophen would have been the one we would tell you if you're allergic to NSAIDs. So you're allergic to everything that we would want to tell you. So I don't want you taking turmeric either, because that would behave like the ibuprofen and naproxen and aspirin. So unfortunately, you'd be one of these subsets where probably something like tramadol would be appropriate for you, but you'd want to use it very, very carefully because it is opioid based and does have an addictive component to it. So you'd want to work with your doctor. Basically, when, in a lot of these days, at least in the United States, the opioid crisis is huge. If you go into your doctor and say, I'm allergic to these, they're going to think, hey, I'm drug seeking and you got this undiagnosed pain, and well, that's what's worse than a toothache. I mean, not much. So I think it's appropriate to use pain medication, but with your allergies, it's very severe. So it makes it very challenging. So there's not a lot that we can do other than opioids to try and help you. So but use them very, very carefully. Addiction is no joke. It's very real and very serious. So just be careful and be very upfront with your doctor with your pain needs and what needs to be treated. So I wish I could give you a better answer. I'm sorry.
All right. Oh, Julie.
Hey, Julie. All right. Is prednisolone the only thing for polymyalgia rheumatica? Nice job on the spelling, Julie. Prednisone steroids are used often with that, basically because it's a autoimmune disease and it helps to cut down on the inflammation. Long-term use of steroids, though, as I'm sure you know, are probably there's lots of other steroid side effects that can happen when we use prednisone long-term. Doctors will try and keep you on it at the lowest possible dose that they can without causing side effects. So there's kind of a balancing act with that. So we have to be real careful. Unfortunately, just because the disease is kind of tricky to deal with, there's not a lot of other treatment modalities other than using the steroids. So lowest dose is most ideal because we want to keep that at bay, because obviously when you get a flare up, it's pretty miserable. Sorry about that. All right, what else we got? All right, for Bobby. Hey, Bobby. Recommended products for peripheral neuropathy. Okay, Bobby, great question. So peripheral, yeah, we're probably going to be doing a video on this.
Yeah, we were just talking about
this. Peripheral neuropathy is some seriously annoying pain. It is unbelievably uncomfortable. So it can be brought on by a variety of other, whether it's diabetes, nerve damage, spinal compression. They're kind of some of the manys.
Right.
So the treatments of choice, obviously physical therapy, if there's something mechanical that we can undo. I guess Brad can touch on that a little bit.
Right. Just to do things, the big goal is to keep the circulation and things moving in the involved part. Oftentimes it's below the knee, is a very common peripheral neuropathy.
Yep.
So there's stretching, there's some self-massage or massage tools that may be appropriate for you. And that depends on if you have a lot of numbness associated with this. Then you have to be careful because like if you use a massage gun and you cannot feel how hard it, you can judge the pressure to put on, then you want to stay away from that. But the foam rollers can be a good way in exercises. We're going to have a video on that probably the next month or so.
Yeah, but just to jump back on the medications, there are three major ones that I see most commonly going to be your gabapentin, pregabalin, and then probably duloxetine or Cymbalta. At least in the United States, are ones that we use pretty regularly, and they seem to help to improve pain. In the case of duloxetine specifically, with pregabalin and gabapentin, they seem to improve neuronal transmission. So when you are, if you think of neuropathy as the highway's been blocked, and so we're getting these really awful burning pain sensations or tingling or even numbness or lack of feeling, it helps to kind of bridge that to try and improve that sensation to minimize the pain or improve feeling. A lot of times when we have neuropathy, the cat's out of the genie's out of the bottle. You can't undo it completely, but we can try and make it a little bit better with pharmaceuticals and physical therapy and proper posture and strengthening exercises as much as we can. So definitely work with your doctor or neurologist and see what we can do to try and get you a little bit more relief on that. So great question.
Okay, here we are on the last one. Oh, okay, Cheryl.
Hi, Cheryl. All right, not supposed to take NSAIDs because of stomach issues. Is turmeric hard on the stomach? Yeah, Cheryl, unfortunately, that's an excellent question, Cheryl, and you should not use turmeric because turmeric is a natural NSAID. So it behaves just like ibuprofen, aspirin, Aleve. So if you're, basically when we take anti-inflammatories, whether it's an NSAID or something natural like turmeric, our body inhibits prostaglandins, and that's why it works really well to reduce inflammation and pain. But our prostaglandins are what makes that mucousy stomach lining. And so when we take drugs like this, our body doesn't produce as much prostaglandins, so ulceration can occur. So your doctor is having you avoid those because that could become a very real problem for you. And obviously stomach ulceration can lead to some, GI bleeds or something more severe. So we have to be super careful with that. So for you, acetaminophen or paracetamol, depending on where you are, it would be probably the most safe choice at that point. With respect to the types of pains, depending upon, whether it's, a joint pain or something, maybe physical therapy, chiropractic care would be other things that you could probably look at to try and find some relief. But acetaminophen is probably about it. Ice, I guess, would be another non-drug thing, even heat, depending upon the nature of that. I don't think it was specific.
Yeah, it wasn't specific. Okay.
So hard to tell what type of pain you're being treated for. Do we have it? No. Okay. Sorry, but I mean, ice, heat, massage.
Yeah.
I mean, there's,
I guess location, you could use a TENS unit.
Yeah.
Again, which is completely, natural, except for the fact, it's used with electrodes on the skin.
Yeah.
It masks. There's a whole theory behind why it works. I'm not going to get into that, but it can be a good pain management tool too if you're unable to take medications or want to avoid that. But that is something you have to be educated on. But they sell them relatively inexpensive now, and you can use them long term as you want. So,
all right. Wow. That was a fast hour, guys. Well, thanks for time. Excellent questions. I really enjoy this when you guys come with all these excellent questions. Right. So it was a really great day. Glad I could spend a little time with you guys.
Yeah. Thank you, Chris. And once again, I learned a lot and have a hard time. I just cannot figure out how you can remember all those drugs. Do you ever write them down? How many you can remember? Is there hundreds of them? Do you know hundreds of them? There must be thousands.
Well, I mean, but drug. I mean, it's kind of a trick to it. I mean, so if anybody's like an aspiring pharmacist or even a doctor, for that matter, or a nurse, we're taught that drugs are in groups. So like your ACE inhibitors. So there's 20 of them on that group. NSAIDs, there's 42.
So you got your separate files.
Oral contraceptives. So it's just like having a file cabinet. So I'm not that smart, guys. Yeah. Every pharmacist that you would have on this program would be equally as knowledgeable or even more knowledgeable than I would be.
I only have one file in my brain. I can't remember more than one.
But I mean, so we learn, and a lot of it's through repetition. So that's how we understand.
I think he's ready to turn us off.
All right. Thanks, guys.
Enjoy the day.